All right, so we're going to talk about a common problem people have, IT band pain. Some people even get bursitis on the outside of their hip. So with your IT band, it is a thick tendon that runs down the side of your leg. Two muscles feed into it, a small hip flexor called your tensor fasciae latae or TFL, and your glute. And those muscles come together to form this band that runs down the side of your leg. Typically the issue with this band is that these two muscles that feed into it, the one in the front tends to get tight and become a lot more overworked than your glute, because a lot of the stuff that we do is repetitive lifting our leg forward, repetitive leaning forward. So over time, in general, we tend to use more of the front side of this band than we do the back side. As that imbalance starts to grow, this band will tighten and it can create some pain or snapping up at the top of the hip. You can have pain that goes all the way down the outside of the thigh, and then down where the IT band attaches, you can get some pain or snapping across a bone that it runs over as well. So the first thing you want to look at is you want to try and balance out this system a little bit, basically trying to get more mobility through here and more activation on the backside. So as we do that, the first piece, as I talk about in a lot of these other videos, is you have to have good control through your trunk. As we're doing things to try and stretch this hip behind me, it's going to be very easy to work around this tightness and let your back arch. So you want to make sure that first off you feel some tension in your stomach. That tension is going to keep your back neutral so you get more of a stretch and motion through your hip joint. So one of the positions I like to start off with is just in standing in somewhat of a lunge, trying to get into this hip extension without feeling pain or pressure on that band. So I may start off with someone actually just feet side by side, and I'll have them leaning on the counter, leaning on a wall, and I'll have them walk back till they feel a little tension in their calves. And I'll start off here just seeing if they're able to control the positioning of their back. So a lot of people, as they get here, they'll maybe be like this, right? Where my pelvis is tipped forward and my back is arched. Starting off, I want them to feel the two positions. So I want them to feel what it feels like to tuck their butt underneath them and feel what it feels like for their pelvis to dip forward. So I want those people not to go to the extreme of this, but I want that butt tucked underneath them a little bit so their lower back is flat. And from here, I'm going to have them squeeze their butt and just raise up as high as they can onto their toes to try and engage some trunk stability, some activation of their glute and their calf. Now, as that's going okay, the next thing would be to try and get them into a little bit more hip extension. So now I would start to take my front foot towards the counter, and let's say this is where I have this pain down my leg. I may start off here just having them press down into the counter with their hands so they get a little tension in their stomach. I have most of the weight on my front leg, and I may try and just keep that stomach tension as I very lightly straighten the leg and bend the back leg. Every time I straighten, I squeeze my butt. I should feel a little bit of a pull in the front of this hip, and then as I relax, I shouldn't feel much of anything. So it's just a pumping in and out of this stretch. So now I'm just gradually trying to activate this part of that band more and loosen this up. Right? And then this can start to feed into a little progression, right? So I can take this leg further back behind me. So you can see I just bend my knee a little bit. I press down into my hands so my back's not falling like this, but I'm pulling my hips under me, and I straighten that leg. And the further back I go, the stronger stretch I should feel. I just have to make sure that if I go too far back, I may not be able to still control my stomach, so I might start falling into this, which I don't want. So if I can find that range where I feel stretch, and maybe I've done some pumping, maybe I've done some holds and that feels all right. Now I'm going to see, can I keep my stomach and let go of the counter? So I'm really engaging my stomach and my butt together to feel this stretch. This becomes even a little bit of a challenge for balance. This sets the stage for a lot of the strengthening stability work that I'm going to do, right? So this is a nice progression to begin for that IT band. Another thing that's important to note is when I am squatting or if I'm doing a lunge, typically my knee, the positioning of it is very important. So if I let my knee cave in even just a little, that caving in makes me use more of the lateral aspect of my quad and puts tension on my IT band. The more that I can pull that knee out to the side without necessarily rocking my foot off the floor, but keeping my big toe on the floor as I bring that knee out, as soon as I do that, I now feel this engage more. So you want to see that this part of my quad and my glute on the outside work together. Right? As my knee caves in, now this isn't working very much, and this is doing all the work. So this is a common reason that we get some of that tension, is you have some glute weakness and you can't control the positioning of that knee. And as you're doing things, maybe you get out of a chair and your knees cave in, Maybe every time you go up a stair, that knee caves in. So every time your foot hits the ground and your knee's bent, you want to pay attention to what is my knee doing? Is it caving in, or do I need to really think about pulling it out to the side when I go up that stair? Or do I want to think about when I go to get out of a chair, instead of getting out of a chair and let my knees cave in like that, can I think about knees out as I stand up? Which usually will decrease the tension on that band. So a couple little subtle things throughout your day. The last one I'm going to mention is most people when they're standing, a lazier way to stand is that hanging on the hip position. That's another position that we like because it doesn't really require any energy to do that. I'm just hanging on the tension of that band, which feeds into over time it tightening up. So this is another position that I maybe want to avoid, trying to keep more of an equal weight bearing through my feet and trying to keep a little bit more active in my hips as opposed to just letting myself hang on that band. So a couple tips to get started. You'll see some other things that take these sequences to a little bit more of a challenge, but these will be a couple things to begin with.